number 3 gives us, I'm going to say, so that we can apply these capability elements, is really what they are. It's what the person has to be capable of doing to produce a good S sound, and we can apply these things in our therapy. That's exactly what we're going to be doing today. So here we go. This is your movement pattern. From the desirable tongue resting position, did you notice that your jaw lowered and rotated forward ever so slightly? Did you notice that the sides of your tongue held on to the insides of your top back teeth? Did you notice that your mid-tongue contracted a teeny tiny little itty bitty bit? Here's my tongue, front and back. Here's the mid-tongue. Did you notice that your mid-tongue contracted a little bit? Go ahead and do it again. That's kind of a tough one to notice. Feel that? Your mid-tongue has to contract in order to move the front. So the next one, did you notice that your front tongue lowered vertically? So from the resting position, the mid-tongue contracted and the front tongue lowered just a teeny tiny little bit. Sustain that position in space as air flowed centrally through that constricted space of the tongue tip and the blade and the alveolar ridge. So that is your first fricative placement. Did you notice that? The mid-tongue contracted, the sides are on the side teeth, the front part of the tongue lowers and allows just a little bit of air to push through, okay? And here we just did A, you see down there? Then B, the air continues to flow through the approximated front teeth. Now, what in the world is that all about? Notice my teeth and my jaw. Do you feel that when you do it? You'll feel just a tiny, tiny little bit, and it has to do kind of with the way that you are structured, okay, with your craniofacial bone structure. But always, to do a good S, we approximate those front teeth because that generates the secondary fricative placement. The air goes through the blade and the tip of the tongue and the alveolar ridge, but it keeps going and it goes through that space that is created with the top and bottom teeth. And that's what gives us the hissy yes that we all know and love. That's the hiss. So, no front teeth, no hiss. See? It's not just about the front part of the tongue interacting with the alveolar ridge and creating that fricative placement. It's about that as well as the teeth coming in close proximity and the air coursing through. Okay, gotta have it. So the jaw is extremely important because the jaw is the one that is rotating down and forward a little bit to get the teeth into place. See, we don't want that jaw to influence that tongue to move down and forward. So that tongue has to anchor on the insides of the top back teeth. See? So what do you have here? You have a little jaw movement, anterior dental approximation. You have lateral margin contact, mid-tongue contraction, front tongue vertical movement. See? Those are all capability elements. Lateral margin stabilization. Mid-tongue contraction, which is mid-tongue stabilization. Two forms of stabilization, external and internal. Your movement, the front part of the tongue lowers and holds. Air flows through, and there's your S. So what are we going to be doing in therapy? We're going to be working on lateral margin stabilization, mid-tongue contraction, front tongue vertical movement, and then adding the jaw and the jaw movement and the anterior dental approximation, and then adding that airflow. And the airflow should be just fine. If you have lateral margin contact, I have my big old mouth here. If you have your lateral margin contact, you don't have to worry about air seeping through the sides. If you have a person with a lateral S, or lateral S and Z and SH and CH and so on, then they're not getting the lateral margin stabilization that you have to have, because that stabilization is what blocks the air and channels it centrally, right? Okay, so you've got to have that. Now, one of the pieces is resting postures. On page 6, oral resting postures, lips closed, tongue up, jaw gently relaxed. You've got to have good resting postures in order to establish that operating zone for your good S. What does that mean? That means when you rest your tongue up here, you're touching the sides. Your tongue is near the S placement. You are right in that operating zone, that optimum operating zone to produce a good S. So resting postures is one of the keys to getting a good S and then to keeping it. So resting postures is a huge piece of carryover. Okay? Now, you've also got in the back, and you can look at this later, obviously, you've got on pages 8, 9, 8 and 9, actually, I'm sorry, 7, 8, and 9, you've got some speech pictures. Okay? And this shows you and tells you about lateral margin stabilization and all of this, and you can actually show this to the kids and or tell them about it. And then it gives you all sorts of information here that we're going to be talking about and a few things that we're not talking about in relation to S. All right. Now, one more thing here. What about that tongue tip down S? And you may even be a person that does a tongue tip down S. Well, you know what? Here's how I view a tongue tip down S. I view it as normal.